This is a training video for anyone that's going to be doing contact tracing calls and interviews. So typically after a case interview, somebody we know who has either a lab confirmed or a presumptive case of COVID-19, we call all of their contacts that they give us over the phone with the initial case interview. During that contact discussion, we verify the contact that that person had while protecting protected health information. So we typically try at all costs to ensure privacy, but we do let people know that there is some concern that they've been exposed to COVID-19. And we also talk to them about the date of exposure, and we try to understand what that exposure might have looked like. In most cases, people understand where it was and they kind of can identify that. And in some cases, they can't. But we typically say, we believe you were exposed on such and such date, which we've learned from the case who's given us this person's information and when they think they contacted that person. Most of the time, these are household contacts, or in the employment situation, they may be contacts on a certain day of work or a certain day in a hospital or a facility. So it becomes pretty clear most of the time. We then explain what quarantine means. Quarantine is when somebody who is not having any symptoms or asymptomatic stays at home during a period of time at which they're at risk for an infection. For COVID-19, that's 14 days from the date that they were exposed to a symptomatic person who has a COVID-19 infection. For people who are symptomatic, or they maybe weren't symptomatic and then they become symptomatic, the difference is that then they are placed in isolation. Isolation is different because that means you actually do need to be away from your household contacts. And we've discussed that in a different video, and we have other information on our website about isolation. For quarantine, we explain that you can stay in your home, you can move about your business in your home, but it's important that you don't go out and about in the community because we're worried that you have a high risk for this infection developing, and we don't want you to transmit it to anyone else. We also explain what quarantine means over the 14 days for healthcare workers, because the Centers for Disease Control has also explained some interim guidance because our workforce is actually quite low right now. So when we call normal people who are not healthcare workers or first responders, we explain the 14-day quarantine just as I did earlier. But if they're healthcare workers or first responders, we also explain that though you will get a quarantine order from us, you may be called into work, and that is acceptable per the CDC based on your employer's guidance. We have separate documents posted on our website about our workflows for healthcare providers and first responders. So feel free to check those out if this applies to you in your community. Once we've talked to someone about quarantine and we ensure that they aren't symptomatic, so they have no symptoms but they have been exposed, we explain that they will receive a packet from us in the mail. That packet includes the following documents, which are also on our website and can be downloaded. The first is an order of quarantine, and this explains what quarantine means, the exact same information that we've just explained on the phone. But it also has a phone number, a 24/7 physician line, that they can contact us at any time. We have many contacts who have become symptomatic in recent weeks, and they call us to let us know they've become symptomatic. We then switch them to isolation and talk to them more about what this infection means and what symptoms they need to watch for, whether they can stay at home with mild symptoms or whether they become sicker and need a higher level of care. This is a very important part of our strategy to ensure we're providing people with the safest guidance possible to make it through this infection and be healthy on the other side. Additionally, this packet also includes information about isolation at home. Even though these are people who are quarantined and not isolated, we give information about how to prevent transmission of the infection at home, including cleaning and hand washing and those sorts of things. We also include information about managing stress and anxiety. This is a very stressful event, and it's very hard for people sometimes to manage stress and anxiety, especially when you're stuck at home. So we have information here as well about that we send in that packet. And finally, we send a green sheet, which we also send to people who are isolated, to let them know that if they become symptomatic and need to go through an ambulance or an EMS service, emergency medical service, to the hospital, they can notify those folks in advance so that everybody knows that this person may have or has been exposed to COVID-19. Finally, before we conclude the interview, we ask a little bit more information just about the person's exposure and their past medical history, just in case they get sicker, and we have that on file. We don't do a full case interview like we do for someone who's lab confirmed or a presumptive case, and we don't do a supplemental form, but we do create a packet, and then if someone becomes symptomatic, we pull that packet back out, call them back, and do more information about their history and about their contacts, and then we start a contact tracing interview for that person. So the quarantine interview is typically shorter, but we do still have a same packet, and we do still like to track everyone who's who's contacted that person. In our workflow here at the Cuyahoga County Board of Health, we typically have the public health nurse workforce, which is very robust, come in every day and they get a list of contacts, and then they call all the contacts that were identified from the cases earlier. So we have that workflow also on our website if that is helpful for you in your local health department. Everyone has a different workflow and a different workforce, so we're just sharing what's worked for us. We've made many changes to our workflow and we've had different groups of people doing the contact interviews, which is why we're recording this, because we are certain our workflows will continue to evolve as the number of cases increases and as this crisis unfolds. Thank you.